We're delighted to have two speakers today, Jiaying Zhao and Alice Hopkins. Jiaying is an associate professor and Canada Research Chair in the Department of Psychology and the Institute for Resources, Environment and Sustainability at the University of British Columbia. And Alice is the Program Manager at Foundations for Social Change. And today they'll discuss the New Leaf project, which studies the impact of unconditional cash transfers to individuals experiencing homelessness.
We are tackling a critical issue in Canada and US, which is homelessness. It's a growing socioeconomic and health challenge in Canada. So on every given night, 35,000 people experience homelessness as a result of evictions, job loss, domestic violence, mental health issues, and addictions. In any given year, about 250,000 individuals experience homelessness. And this presents a significant cost to the government and to society. So every year it costs anywhere from $55,000 to $130,000 per person to run social services and healthcare and justice services. This is a very costly status quo that we are kind of just accepting by default. And the picture is very similar in the US. Of course, the population is bigger because of the bigger population in the US. And the shocking factor is almost 200,000 children are homeless on a given night. And that's just not acceptable. And these approaches are adopted by countries around the world to address homelessness. But ironically, these approaches do not tackle the core cause of homelessness, which is the lack of money. In fact, a prevalent reason for becoming homeless is simply not being able to pay rent. And so I think this is a motivation for us to try out our approach, which is to use unconditional cash transfers to reduce homelessness.
This project was co-founded by Claire and Franz, who you can see there, and really was inspired by a couple of things. So a TED talk by the historian Rutger Bregman about basic income, and also a very small project which was actually started in the UK, London, which involved a group of chronically homeless men who received unconditional cash transfers, and the results were really promising. They weren't academically evaluated. There was a lot of promise. And so that's really what inspired the two co-founders to really ask, well, given the circumstances in Canada, what would it look like to try this here? And so really the mission of the New Leaf project as it was first born was to really use unconditional cash transfers to empower individuals to move beyond homelessness, improve the overall quality of their lives, and really to shift what we saw was really an entrenched understanding in society that, you know, being homeless is not a character defect, it's a circumstance. And unconditional cash transfers were really a way to recognize that.
So this is the randomized control trial that we ran on the New Leaf project. And we asked, what is the impact of this one-time unconditional cash transfer on recently homeless individuals? So this RCT involved a one-time cash transfer of $7,500, this is Canadian dollars, to the checking accounts of the 50 individuals who are recently homeless in Vancouver, with another 65 individuals as controls. And the reason we chose $7,500 is that it was the annual income assistance in British Columbia back in 2016 when we finalized the project design. So here's our summary. We're working in Vancouver, which is one of the most expensive cities in the world. We're working with the most impoverished people in this city with the highest rents and the lowest vacancy. But even so, we found that cash transfers reduced homelessness, increased savings and spending, and generated cost savings for society over 1 year. We did not see increase in spending on temptation goods among the recipients, and the cash transfers can be a cost-effective approach to reduce homelessness. So the tentative policy recommendation here was to distribute the $7,500 to recently homeless individuals without severe substance use, alcohol use, or psychiatric symptoms. So that's the policy recommendation from our work. So this is how we work together from the UBC research team and the New Leaf project team. So for the research team, which is me and Mayan and Anita, We're responsible for overseeing the research project, getting ethics approval from UBC, collecting data, running data analysis, and writing reports. So we're supervising the research component of the project. Whereas for the FSC team, I think Alice and your team are responsible for fundraising, partnership building, hiring staff, and coordinating interviewers or connectors to collect data. And jointly, we're responsible for the entire project design and execution. So we meet on a weekly basis, sometimes more often when needed. For COVID, we will meet in one room, the office, to discuss project progress, to problem shoot any issues that arise in that given week. We co-present to partner organizations, policymakers, and we celebrate project milestones. And we also support each other. That's the most important aspect of our meetings.
Again, I just want to emphasize in terms of co-leadership and working together, I think the way that we work together in the pilot has really carried through to how we redesigned the expansion project. Again, we met regularly and really brought all kinds of different perspectives to look at the lessons learned from the pilot and think about what we wanted to do differently. And one thing I just wanted to emphasize, especially for this presentation, was just that, again, the kind of interdisciplinary nature of the team really, really worked in our favor and gave us a lot of strength when we were communicating the findings out there to the press, because we had Claire, our co-founder and CEO at the time, who could really speak powerfully at a high level to kind of why the results were important in a societal, wider context. We had Jiaying, who was able to speak to the research specifics and really gave a high level of credibility to the work. And then we actually had Ray, who was a participant who received a cash transfer. And he is a fantastic public speaker and spokesperson and was able to speak very directly to the impact that the cash transfer had in his life, which was extremely powerful. And so everyone was really trained to speak about the key messages, but all really brought their own kind of color and background to it. So that was a really good example of how we work together, I think.
Have you experienced any challenges in balancing the effort needed to prepare publications and the effort needed in maximizing the societal impact of the work? Or has it been possible to balance those two fairly easily?
Well, I think the two going hand in hand. I don't see a significant trade-off between the two. If it has important societal implications, then it should be published in an academic journal. Now, having said this, I do think there was a brief battle between scientific rigor and practicality. So for instance, I just remember the battle with ethics board was, why do you have to run it as a randomized control trial? Why can't you just give the cash and do it a pre-post comparison? And of course, running an RCT is more expensive. It actually involves more costs from FSC. And I had to make that case many times to say why we need an RCT as opposed to a pre-post comparison. So I think there are certain scientific standards that we need to withhold as academics, and that may be inconvenient for a lot of people. But I think FSC is on board, our partners are on board. That's a battle worth fighting for.